Littleton, it is December the 11th in 2024. It is 7 p.m. and we are getting ready for our Board of Health meeting for December the 11th. We have a packed agenda. So let's go ahead and start with, hold on one second, because my PDF viewer is in the process of crashing and coming back up. But I believe we have Jack Maloney here from Dillis and Roy to walk us through the request before the board. So why don't you go ahead?
Share my screen.
Yes, please.
Can everyone see that?
Yep.
We can site locus really well.
Thank you. Heading south on Tehadawon, heading up the hill, we're on the right-hand side before you get to Harwood. It's number 161 Tehadawon, and I'm here on behalf of Alexandra Essman. She has bought an existing 3-bedroom house and would like to upgrade it to a 4-bedroom house. There is town water accessing the house from the front yard, as noted here. The pink is the property. The little blue line back here is the edge of wetlands. We have the 50-foot and we have the 100-foot buffer shown in orange. We have in yellow a Presby system sized for a 4-bedroom house. And due to the groundwater table, obviously you see the fill and grading that we have. One of the variances that we're here for is regulation 23, impervious barriers and fill to a property line. The system is designed with the poly barrier being proposed. The system also has fill and grading to within 3.6 feet of the abutting lot. And then regulation 27, the system has fill and grading to within 3.6 of the abutting lot. So we were able to keep 13 feet from the left side and the south side property line here. However, on this side over here, we have about 3.5 feet to this edge over here. However, you can see the abutter here. It's Alexandra's parents who own the lot next door. So they have no issue with this. Abutters have been notified. I did send the return cards and returned envelopes back to Megan and Francis this afternoon. So other than that, those are the only 2 variances that we're looking for local upgrade approvals, however you want to look at them.
Okay.
And just a side note, this has already been through conservation and has been approved through conservation.
Awesome. Glad to hear it. All right. Megan or Francis or Judy, could you promote Kevin? He's currently in the audience.
I can do that, yeah.
Thank you so much.
Yeah.
All right, why don't we go around the room? Dan, Mr. Kane.
Do we have any comments from our agent before we?
Oh, there we go. Thank you so much. I see no comments from it unless Francis.
We have Francis with us.
Yeah, I was going to say unless Francis has something.
So it looks like he's proposing the impervious barrier to help lessen the fill. I think that's reasonable considering where it's sited on the site. I don't really have any other comments, really. I think it's an appropriate design. I talked to Jim briefly today, and he said that he thought it was a well-thought design for the property and sees no issues with it as well.
Okay. Dan?
Sorry about that. Actually, I don't think I have any comments at the moment.
Okay. Gino?
Yeah, I understand they wanted to put an extra bedroom, and they also going to put a new sewage disposal system. So I don't see why, if the house is capable to put another bedroom, That's because they might need it. That's my my thoughts. I'll leave it up to you guys.
Okie dokie. Dan, refresh my memory. It's within the 50 foot or the 100 foot that we have a special handling. I thought it was within the 50. Is that right?
It's
So-
within. Oh, go ahead, Francis.
Nope. Sorry. Go ahead.
No, go ahead, Francis. Let us.
As our agent, you should be more familiar with the regs than I am, probably. So
So he's just looking for the 10-foot from the property line requirement for our own regulation.
Yeah. No, I know, but I thought like last year or something we looked at improving the lot line.
I think that was only if it was an offset from the high water table, the groundwater table.
Oh, okay.
I believe it was offset and 100 feet. If it was an offset variation, I think it was 100 feet. But
And we're doing
Francis, do you happen to remember that regulation?
Kevin's got something. What were you going to say, Kevin?
Are you referring to within the 100-foot wetland buffer?
Yes.
The need for treatment?
Yes.
Only if you're going for the 2-foot. I didn't hear what the first variance request was. I heard the lot line on regulation 23.
Yeah.
Are you going for groundwater
Very-
offset too, Jack?
No, because this is considered new construction, so
Oh, so you can't.
we're at full compliance on that.
Yeah. Okay. So Kevin,
we
it would
have
only
a
apply
5-foot
to
We actually have a 5-foot groundwater offset here because
Oh.
we had 2-minute per inch perk rates.
oh,
So,
too fast.
yeah, and I think you're right, in regards to if you're less than 100, and you have a 2-foot groundwater offset that you would need to provide some treatment, so.
Yeah. Okay. All right. So I did remember correctly, just not completely correctly.
Almost.
Almost. So close. All right. Kevin, do you have any other comments?
I don't.
Okay. I have no other comments. So knowing that, do I have a motion?
Any abutters?
I don't know. Do we have any abutters? We have a guest and no hand raised, so I'm assuming no abutters. Nope, no abutters, no raised hand.
I'll make a motion that we grant a variance to the owners of 161 Teharawan Road for the use of impervious barriers and fill to less than 10 feet from the lot line.
I second.
We have a motion and a second. Let's take a roll call vote. Kevin Baker,
Your votes yes.
Gina Fratelloni,
Yes.
Dan Kane,
Dan Kane votes yes.
and the vice chair, Kevin Davis, votes yes. Okay, Mr. Maloney,
Thank you very much. Have a great night.
thank you so much.
Thank you.
All right. Our second one is for from Integrity Design and Builds. Is that right?
Mr. Chair.
Sorry.
So they made a last-minute plan design change, so I moved them to the January meeting because they just submitted it yesterday. So we could just open the hearing and then continue it to the January meeting.
Okay. So our 710 public hearing, 9 Aspen Road. I need a motion.
I'll make a motion that we continue the hearing until our January.
I second.
I don't have my calendar up, so I don't have a date. Stand by.
I second.
A minute, Gina. We don't have a motion.
January 8th.
Thank you, Francis. Faster than me. I make a motion that we continue the hearing for 9 Aspen Road until January 8th meeting.
Okay. We have a motion.
You have a motion.
Second.
Thank you, Mr. Baker. Second. All right. Gina Fratelloni.
Yes.
Kevin Baker.
Kevin Baker votes yes.
Dan Kane.
Dan Kane votes yes.
And the vice chair, Kevin Davis, votes. Okay, so we have in our packet this from Integrity. Is this this is the one that we're pushing on to the next one? Is that what it is, Francis?
Yep.
So we can skip that completely. All right. Excellent. The next thing we have on our list at 7:20, so we're about 10 minutes ahead, is the discussion on the ID support tool. So I don't think we need to delay on that because it's not a public hearing. So unless anybody else objects, I say we press. Is everybody okay with that? Okay. ID supports decision support tool. Our normal person, Matt Wason, would be here to present that unless one of the other board members got the information from Matt to present. Francis, did you get the information to present?
I'm seeing if I can pull it up remotely right now.
Okay. I did not get the information from Matt, so I apologize to the board for that.
I cannot. Sorry.
Okay. Well, then, does anybody have any general comments as far as the diseases that would be tracking on that? That would be COVID-19. I do know that it is up and out and circulating around. So that's definitely going on. I also know that we have RSV is starting to increase, as is flu. So those are the basic ones that I know about. We also are no longer tracking Triple E or West Nile because the mosquitoes have frozen. Well, not tonight. Maybe they might come back tonight, but not really. Okay, so we are going to go on to our next item, which is the discussion on the air quality detector grant. So who wants to go ahead and lead that discussion? Is that you, Francis?
Sure. So we have received 10 air quality sensors from the Mass DEP, and right now we need to place locations. So this discussion will be to generate ideas of where we think might be plausible places and that could work in town. So I can compile a list and we can make a definitive list for the next meeting. So general areas or particular spots in general are helpful. If anybody lives in an area where they want to house a sensor, possibly, that is also an option.
Okay. So obviously around schools is an idea. Yes, no?
Yep, so schools are fairly easy. Anything that's owned by the town is fairly easy because we always have a network and we always have a power source.
So the peaker plant or near the peaker plant that we have?
Yep. So I've reached out to Water and Electric and asked them if we can utilize monitoring stations because they also have those as well. So we should.
So they already have some there.
Yeah. So they have a station that already has those already on board. So it's a question of figuring out how to connect it with the technology. But
so we might want to place one there to see about calibration between their sensors and our sensors as they came from the DEP. So their calibration, I'm not saying that they're off or anything like that, but we should at least have something there for a little bit to verify or validate their data. Dan, you look like you're thinking out loud.
Sorry, I apologize. No, I was trying to figure out. So, my question is, I did not realize as a board member that we actually had some peripherally town-owned air quality sensors in place already. Is there a way that we can access that data? Is it logged historically? How is it reported? Who reports it? Who gets the reports? Yada, yada, yada. I love the fact that we have some air quality data for some length of time, that would be wonderful if, as a board with responsibility for air quality, that we, one, knew that was there, two, if we can access that data so we can see if it calibrates or not. Now, I don't even necessarily think we need to put two next to each other to see if they correlate. But is there a way that we can integrate that data into others, and that basically creates 11 sensors we have in place, or potentially have in place, so that we don't remap what we already are mapping. We can use that sensor perhaps someplace else. Just in general, as I'm looking at it, I think for my big approaches would be areas of population, areas of risk. So off the top of my head, so let's say, areas of population, schools, easy. We hit middle school or Russell Street, we're covering a big hunk. Something closer towards high school, Indian Hill, Corporate Field, that side, we're probably covering kind of a general area. The lakes, with the density of population there, I don't foresee a big risk just from windshield survey of the area, but we got a big population area, so it's kind of it would be potentially impactful if there is. And then areas of risk, I'm thinking places like the quarry, simply because we have anecdotal but tactile evidence of potential challenges. Areas near high school, areas near the highway, high traffic areas, high trucking areas. I'm not going to pick on Amazon, but I'm just going to use them because it's an easy one to think of for location-wise, of lots of trucks, small area, that kind of piece. So my kind of mindset would be population centers and areas of potential risks, concern, just from the demographics. So high traffic, places that are putting out potential pollutants, particles, whatever, and places near the highways. Some of those things we can double dip.
Yeah.
If we're looking at Route 2 495 intersection, if we hit kind of the industrial stretch there on Taylor Street, we're kind of covering a bigger area with one sensor, perhaps, if we can find the right spot.
And it's also in a valley, so that would be kind of fun.
And then also just a little bit of, depending on what we have for our numbers and what makes sense, just having some geographic distribution. I would hate to see everything we'll pick the west side of 495 and have one sensor on the east side, because we want to make sure that we're covering population centers, but also a fair geographical distribution, that we're actually kind of making sure that we're getting good data across our community and not only in either high population or potential high risk areas.
One by Long Lake, because we already have the accessibility for town right there. That would cover a lot as well. The other thing to think about too, for air quality issues, I would also think around our cannabis shops as well, because we've had nuisance issues. We might think about that. I'm not saying that's a final thing, but that would be an interesting idea.
Now, do we know the technology for the sensors? It sounds like it's 2.5 micron particulates. So I'm not sure that's really going to do much because most of our cannabis shop challenges are odor based. As opposed to particulates. So I'm with you. I agree. I'm just not sure how.
Oh, I didn't know the sensors were 2.5. I didn't realize. I
believe. I looked when we first heard about them. I looked them up, and I'm working from memory, so I could be wrong, but I believe that was the number.
That's correct.
I'm not sure. Is it okay?
Okay, then that changes. That's particulate sensors. Then that's pollution. Okay. All right. Where else do we want to? Kevin Baker, do you have anything else that you want to?
Not off the top of my head.
Okay. I like the approach. Gino, do you have anything?
At the moment, no, but so far we're doing a good job.
Okay. I really like the approach, industry and population, just to cover that. And you said we have 10. And then besides the one at the peaker plant, what else are we doing do we have any other town coverage of sensors that are 2.5 or even better if we have other sensors?
We're still waiting for water and electric to get back to us, because we just recently found out that they might have some in place already. So it's through a different program. But so once we have that, and then I've asked them, what do you have across town, so that we have a broad map. So once we get that list, it'll make it a little easier. So then I can kind of map out where those are in correlation to where you guys have suggested today.
So I'm also thinking utilizing the GIS database. We could also do some placement things with the GIS and figure out where they would go from that perspective, look at elevations and things like that, wind patterns in town, historical wind patterns, so we can see kind of like where it would make sense to put some.
Yeah, Kevin, if it's all right, I might reach out to you offline because you get the technical aspects of these types of projects.
Sure, no problem. I'm here to help, and we might be able to reach out to a local state university has a GIS program that could help us with some of the placement, and maybe have a student come back and do that as well. What's the board's pleasure for that? Dan?
I think more data is always good.
Okay.
I mean, I'm kind of. I created kind of a ballparky areas, but I'm trying to recreate it because I don't have my notes at the moment. I mean, my first pass is like of locations that are kind of spread and covering at least a fair population.
Yep.
I love the Long Lake spot. It's a good one. It's relatively central to that one. I think I'd put one in the Common. Again,
Yep.
kind of population center, traffic center, and now it also kind of covers the other end of that Goldsmith Long Lake area, because that's really probably our most densely populated single area. So we're kind of catching edge of either end kind of that area. Something down near the Acton line, down near Grist Mill, that area someplace, again, just for geography. It is
Mhm.
relatively densely populated, but nowhere near as much as others, but it's kind of spreading the geography around a little bit. Russell Street, kind of covering Russell Street, the middle school, and it's right next to the highway. So we've got kind of a twofer there. I'd say, again, my personal piece is something quarry area. I think transfer station probably makes the most sense. Trying to balance those two pieces of power, internet access, and location near the train line, near the transfer station with their traffic. The stone yard, it's right there next door, and the quarry, it's probably not a bad spot. Again, I think we'd have to look at kind of geometry or geography and weather and that kind of stuff, but
Yep.
kind of made some sense. Not the best spot, but kind of a decent balance. It's the Whitcomb Ave, the new treatment plant. Again, power, should have internet, and kind of spreading it out a little bit on that side of town. MBA, the T station area. I'm not sure what we have for resources down there locally, but
We
again,
have-
we've got train,
we have-
we've got traffic.
I think we have chargers for the cars that were put in by Littleton Electric and Power, right? Thought maybe.
Yeah, I think so. That's a good idea, Dan. I didn't think of that one. Check that out.
But I was gonna say, it's near the intersection of the highways. It's got the train traffic. It does have a fair amount of traffic for the residents in that area. It's kind of a common pass through for that area, as well as some of the industrial stuff that, I know we try not to have them use that route, but they still get some business and vehicles through that way. 1, 2, 3, 4, 5, 6, 7. 7. Not a great list, but that's 7. And
An
most of them
amazing
have
list.
places we can actually would work. So we have a couple extras to play with. Again, assuming that list seems okay and the geography looks right. But I think that again, my gut is that's kind of a good starting point for coverage. But obviously, I'm open to anybody else's ideas.
Yeah, I like the
Again,
coverage.
sometimes it's having a starting list is sometimes helpful to go. That doesn't make any sense. No, I don't want that. I want this.
Is the
easier.
sensors, are the sensors being rewritten, the data being routed back to the state so it goes into coalesce, or are we responsible for the data collection?
The state is.
State is, okay. So we pick it,
Yeah.
they administer it, and we get access to it. Okay,
Correct.
okay,
And obviously, we can move these over time as well if.
yeah. Yep, but we still have, you said 6 or 7, Dan?
The list I just kind of came up with ballparked was 7.
So that means we got 3 more to play with.
assuming that list makes sense and works for everything else. But
Yeah.
and
Okay.
again, think about the places like I'd say the point and the traffic associated with the point. But if we're doing also in the common, is that really too close to make it a meaningful difference? Exactly. So am I going, yeah, busy area, lots of people, but if we're doing the common, is that necessary? Or do we skip the common and do the police station?
I would say
Again,
I would
I think some of
actually-
this is going to be some playing around with it. I just don't know, but
the other place to think of too is over at the water treatment plant on Spec Pond. Because there's trains that go through there quite a lot. So
yeah, I was just saying, would we catch that stuff at the transfer station
wind goes the other
as
way.
well?
The prevailing wind is away from the transfer station.
Towards Groton and Westford that way?
Towards its transfer station goes towards the point. Think of it that way.
Okay, so I get you. Yep,
My weather station tells me so.
I believe you. So I'm looking at my map on my other screen. So
I get you. I get you. I'm good. My camera's over here and I'm looking at the screen this way.
yeah, I mean, by ballpark, I'm trying to look at other places. Like I'm seeing something that fire station, Castle in the Trees, high school kind of stretch somewhere in there. I'm just not sure what makes the most sense.
Historical
I think-
society. Historical society.
The historical society. I'm like that stretch where again we've got some population, we've got that whole new estate and all that kind of area, and the high school.
And
Yeah,
then
I'm not sure.
the living facilities right there too. So that would be kind of interesting data. And it's up the hill from the Russell Street as far as elevation goes.
Yeah, I think this is a good jump off
Sorry.
point. So I can see what we can do within that areas and then bring it back and we can kind
Yeah.
of see if that's
And Francis,
feasible.
I have no problem getting you in touch with the department chair. I might know a person at a local state university that has a GIS department that is more than willing to have seniors come out and do things like that.
Yeah, definitely. Phrase me.
Cool. Okay. Do I hear any other comments, Gino?
No, thank you.
Okay. Kevin Baker? Okay. Dan Kane, anything else?
I don't think so. Other than what's our next steps? What's our
I think-
timeline? What's our timeline from the grant? Like, is there a need to be in place? But does the state have a timeline for implementation?
They're pushing for us to do sooner rather than later. But as long as we can show that we are making a thoughtful process and putting them in places where we think will have the highest impact, I think they're willing to extend time on that. So they kind of just check in with us, and obviously they want to see them up as soon as possible, but they haven't pushed anything hard and heavy.
So they're saying 6 months.
Oh, no, they wouldn't say that.
Okay.
But figure in the next 30 days, we should have a more general idea of where they're going and already kind of in place.
All right. So let's have another.
Okay, so
discussion.
sorry. So we do have a timeline, and it's relatively short. It's not
Right.
but it's not by July 4, 2025. They're looking January. They want to, if not in place, have a solid plan of when they're
Yeah.
going to be in.
Yeah. So let's talk about January 8th at our meeting. Let's have another quick discussion if there's other things. And then I will try to give the college, the state university is obviously going to be going on winter break. So we're going to, if we want to reach out to that, which I think the state would enjoy that we're integrating that a little bit into it. They may or they may not. We can get their temperature on that. And see if they want to extend it maybe, a month or so or something like that. So, okay. All right. So let's definitely talk about it. You have it on the agenda for January the 8th. All righty. Again, I apologize. My PDF viewer is kind of toasted right now. So the next thing it looks like in 1 point font is administrative issues. Is that the next thing?
Yep. So we can start with the minutes if you want, or
Sure. Why don't we go ahead with the minutes? Did everybody see the minutes? Did anybody read through them? Okay. I'm gonna need a little help here because the minutes that I'm seeing again are super tiny. So
I
it
think the
looks
first
like,
one, and I think is October 23rd. It looks like our first one.
yeah, that's what I can't see it because I'm blind here, guys. So I apologize. So October 23rd. Does anybody have any comments on the October 23rd?
No,
Mr. Baker.
I'd like to make a motion to accept the minutes as presented.
Do I have a second?
second,
I have a second and a motion. Roll call vote. Gino,
yes,
Kevin Baker,
Yes.
Dan Kane,
Dan Kane votes yes.
and Kevin Davis votes yes. All right, looks like we have the next set of meeting minutes is from November
13th.
13th. Got it. Does anybody have any comments on the meeting minutes?
at the moment, no.
Yes, Dan.
Just a quick typo for under meeting minutes for 8/28/24. It just says Dane instead of Dan. It's a very common error. It's a very common error.
I'm gonna,
Also under that code of conduct as well. This is the second paragraph on that one as well.
Got it.
Happens all the time.
Dan. Okay. Anybody else have any other comments for those minutes for November? Do I have a motion?
motion,
A motion that is to accept the minutes as amended?
yes,
Is that what
sir,
you're asking for? Okay, so we have that motion. Do I have a second?
Second.
Second from Mr. Baker. Roll call vote, Gino Fratelloni,
yes,
Kevin Baker,
Kevin Baker votes yes.
Mr. Kane,
Dan Kane votes yes.
and Kevin Davis, the vice chair, votes yes. All right. All right, so those are our meeting minutes. It looks like in the next piece of minutes trivia is the proposed Littleton Board of Health meeting schedule for 2025. Yes, Mr. Baker.
I don't know if anyone had the chance to speak with Dr. Wason, but his last comment to me on this is that he still wanted to meet twice a month, and that he thought we had more work now to do than ever, and he was confused as to why we're only meeting once a month. So maybe if we're going to decide to make a move from twice a month, we should have him at the meeting to determine which dates those are going to be.
I got the same comment from him as well.
Okay.
Did he reach out to anybody else? No? Okay. Probably we should then have that conversation with him at our next January 8th meeting. Or no, we have one more in December, right? Or did we cancel that one? We canceled that one.
Yeah.
So the next meeting is January the 8th. Okay.
right,
So we can have that discussion because it's early enough in the season we can republish our schedule of meetings.
Okay.
All right. The next thing in the packet that's here is the report for December of 2024. Is this the proposed report, what it's going to look like here, Francis?
Yeah, it's a starting template.
Okay.
But obviously it
Do you
can
want
be
to
changed.
walk us through it for the first one?
Sure. So it begins with inspectional data, and then some general notes that I've made just based on what I've seen over the past 6 months. And then we kind of dive into some more community health reporting. I requested to have some more information around more of the singular and unusual cases that might have popped up, just so the board has a better idea of what surrounded those events. And then it dives into proposed FY26 budget. And then some updates below that on things that have recently been done and things that are kind of coming up.
Okay, so are we doing a 30, 60, 90 or a 90, 120 sort of kind of thing? Like we're looking at 3 months and 6 months, or?
So this is 6 months. The chair was thinking a quarterly would be appropriate.
Okay.
And this is just a format that I've used in the past, but obviously we can change it depending on what the board likes.
Okay. No, this is the first time I'm seeing it, so I'm kind of digesting it and chewing it around in my brain at the same time, thinking about what I do with other reporting structures that I work with every day. That's the reason why I asked the question 30, 60, 90, 90, 120. It's kind of like, here's what I'm doing in the next 30, 60 sort of kind of days. This is what I'm anticipating is going to happen. 90 is like that quarter, and then the next quarter out is the 120 sort of kind of thing. So, yeah. If the chair is thinking 90, 120, that's fine. It's just a reporting structure for things like that. What do other people think? Dan?
I love that you said this is kind of a starting point. Is this actually real data, or is this just fill in the blanks to like what it would look like, Francis?
I mean, this is real data, but
Okay.
whatever you think needs to be expanded. Yeah.
Yeah, no, I was just curious. It's just that was my first question, but I mean, I admit I'm a data guy. I love data, and waiting 3 months to see it, it seemed like a long time. I'm sure you're doing effective kind of signaling of challenges and stuff. I always love extra sets of eyes for some of the signaling stuff because it's easy to. Oh, we see one. Oh, we saw one. Oh, we saw one. It's not a big deal. And then suddenly, you're 6 months, 2 rounds going, okay, now there's a pattern that, may have been picked up earlier. Not saying that you won't pick it up, but again, kind of for signaling with small populations, sometimes extra eyes can be helpful, but I love monthly, but I realize that's a lot of extra work. But no, I think obviously the kind of the budget piece wouldn't be in our quarterlies probably unless there's something bizarre happening, but kind of that I love the piece of what's our goals and some updates on where they are. Okay, we're gonna, first annual report completed with the opiate settlement and a line or a conversation point of okay, so what's been done, what still needs to be done short term to accomplish that. Okay, we've accomplished this piece, we've done that piece, we're waiting for this data for the next one, and it'll be coming forward to the board for the review or the townwide committee working on it, whatever, that kind of piece. But yeah, having the goals and then having whatever our update is, either next work piece or most recent accomplishment around it, it would be really nice.
Yeah, you reminded me when you said goals and things like that. Some of the goals that we came out of our workshop that we did, our retreat, some of those immediate goals and longer term goals might be good to kind of start mapping some of those things out that we're keeping track of it as we move forward on that. That might be good. Thank you for the reminder. Mr. Baker.
I like the 30, 60, 90 on the report. And I think this is a good start. I'm happy to see it there.
Excellent. Alrighty. Gino,
Yes.
any comments on the report, sir?
Any comment? No, I don't have any comment.
Okay. Well, I think this is a great first start on this. Mr. Baker.
Francis, do you know the exact date by which we need to report to the select board and FinCom with our budget?
We are still open. So our nursing in particular, I've been talking with Acton, and to kind of go in line with the board's goal of having more kind of a home care and a heavier build on what nursing would look like in Littleton. They're one of the last VNAs in the area, so they are open to sharing a nurse half and half with us, and that would open us to all of their services that they provide, and they have a quite large nursing unit. So we're working with them still. That's not closed. That's not official or anything in that form. So we're probably looking at the beginning of January when we're going to try to button up more definitive.
Okay.
But it could be quite challenging in itself just to try to find a nurse that's not full-time. So I do think it's probably the best way to go, and we will get the most bang for the buck. And they're quite established, so they know the route to go and they know how to carry it out. So I think it'll help us in growing our own nursing as well.
What makes Acton's VNA visiting nurses so robust?
So they have a staff of, I think, about 8, and they provide the full. So they have PT, they have home visits, they have a lot of vaccination clinics, they have pilot programs, they have good connections to services and outreach. So they kind of have everything that we don't have now, basically, or that we'd like to get.
Great. Thank you.
All right. Yes, Dan.
I'm loving the data. Can we ask some questions about the report?
Of course, again.
Absolutely.
All right. So wow, you've had a very, very busy December. You did 82 septic inspections and 65 food service inspections, including 11 housing inspections. That's a very, very busy month with one person. Or is that a combination of Jim and you and others?
So that's multiple months, Stan.
So it's not the report for December, it's the report from some date up and through the.
That's for a couple months. I'd be impressed too if I could do that in 1 month.
Well, so that's why I'm asking. So we got where I was thinking, because I was going to say that seemed like a lot for December since we're at the 11th. So the data window, obviously, we want to make sure that we're reporting data and we know what the window is. So is this January to December 11th? Is this November till December 11th? Yada, yada, yada. So just so we know where we're at. For the inspection notes, like 4 cease and desist letters, a confirmed foodborne illness, some of those things, is that also from some wider window back summer, beginning of the year, some other window, or is this more recent kind of events?
So this is 5 months up to November.
Okay. All right. So that's kind of my big question. Like, wait, we've got 4 cease and desist letters out on behalf of the board and the department, and confirmed foodborne illness, some of those kind of questions. But so yeah, if this is looking further back from that, then that's cool. Again, that piece of that's old data.
Yeah.
I love fresh data. But no, I think the structure works. I was just kind of curious about that. It's obviously looks really, really busy, and looking at this list in our little town going, that's a lot of enforcement action in a short period of time. So if it's actually spread over further, I'm not as startled. Or, some of our disease reporting. 7 cases of tuberculosis.
That's a lot in a year in general, but yeah.
That's a lot of TB.
So is that that was going to be my next question. Is that a real number that we had?
That is a real number.
Wow.
That is quite large. I haven't encountered a number that large for TV.
Is that coming out of the assisted living facility, or?
I mean, some of them are. I don't think all of them. I would have to defer back to the nurse, but
That is
Yeah.
a lot of TB.
yeah, 3 is kind of what you should be seeing maybe in a given year.
Right. Dan, you're on mute, buddy.
Yeah, our population is. I would not be at all surprised seeing that in my clinical setting, because the population I see in my clinical setting is very different than Littleton for the most part. But that's a big number for Littleton. That's not necessarily a big number for Lowell or Lawrence or Greater Boston or Worcester or some other places with large transient populations where, it's a little bit more challenging. So yeah, Nurse Dan is incredibly interested on how we got to that number. And
Kevin, partial data scientist person is interested in, because 7 is in my brain, it should be like 2, 3, 4-ish. I'm thinking for a year, and we're seeing 7. So that's kind of alarming. Alarming might not be the right word.
Interesting.
Interesting.
Thought provoking.
Yeah. Okay. What are some of the other, if you had other concerns that you were looking at some of your numbers, Francis, what other concerns might you be raising and saying, hey, board, pay attention to this?
Um,
DB.
Besides
I was going to say that would have been a great one for Francis to go, by the way, I know there's a lot of data. I'm going to give you my elevator speech on this going, yeah, we got some cases going. Yeah, we get this. By the way, we've got 7 cases of TB. That would be a, hey, just so you know, as opposed to on the second to last page in our packet.
Yeah. You might need a TLDR. Not that anything's too long and we didn't read it, but okay. So is there anything else on the packet that might be interesting that you were looking also from a data science number?
Not so much science, but if you look at the budget for next year, just so you have a general idea of what I'm proposing. So we'd be looking at a halftime inspector, a halftime nurse, and the halftime admin who is already in place. And then I've kind of detailed more of the office essential type of stuff that we would need in place, just so it's more transparent. Before we kind of had, it was just 9,200 kind of as a general item. So this is basically that broken down and cut down a little bit as well.
Do we have, it's always good also when you're presenting budgets, what last year's budget was, and maybe the year before that, a couple of years, so you can see if there's something there. Obviously, if it's new, putting dashes on the prior years are fine with me.
I mean, for the most part, we can consider this mostly just new. So besides like advertising and printing, I think it was advertising, printing, and then travel was the 3 items for office related. And then staffing was directly Neshoba. So we didn't have any items besides that.
Okay. All right, so this is our transition year then. So this is year 1.
That's correct. Yep.
Since we're talking budget and things like that, does anybody else want a chance to chime in on that?
I forget last year's budget. We had a nurse in the budget. We just didn't fill it, right?
Correct.
So it's not really an ad.
It's more than we had. So with Neshoba, it was 15. This would propose 39. So that would be at, I believe, $38.50 an hour, basically for 20 hours. And just to get someone who is good, that's kind of the hourly rate we would need to look at instead of like a 35 or 36. Just so you have someone experienced.
Okay.
Inspector is based off of like a 72, 73,000 a year full time. So cut in half.
Okay. Mr. Baker, do you have anything?
I'm just curious, do we need to include any of the revenue side as far as grants or revenue streams from fees and things like that in the budget concerns for FinCom and the select board when we present, or is it just the expenses?
It's always helpful to show that generating revenue and that this is different than previous years because we have a lot more figures coming into the town than just going out. But also I caution at the same time that, typically the health department is a deficit. And as a health department grows, which we will grow to reach accreditation, the deficit will grow more and more and more and more each year. It's kind of one of those functions that needs to be in place and is right for the town, but there's also a cost that is never going to come close to the revenue. So,
So in other words,
A projection of our income, of our revenue stream is really helpful to show that, yes, our total annual cost is going to be $226,983.03. Our anticipated revenue looking at, or income based on fees and services, we expect 50,000, 60,000, give or take. The same way that, we'll pick the fire department, that the ambulance fund, all the money that comes into the town comes into for ambulance services comes into that fund, and then that actually offsets the fire department's budget and their staffing. So it's the fire department is obviously a loss. However, they do generate revenue through fees and services that does offset their costs a little bit, which certainly makes it a little bit more palatable to both the residents as they're voting on a budget, as well as FinCom as they're looking at the true impact. Obviously we never know what our income is going to be, but we can make some at least reasonable predictions, which makes it an easier sell for all parties involved. We're never going to make money, but we aren't really costing what it says in the bottom line here.
Yeah, just case in point, I'm curious, what's our portion of the public health excellence grant that we'll be receiving for FY26? And, because you're here now, Francis, that's the reason we're going to get those funds.
Right.
So just putting that into the equation so that everybody knows. It's important.
I definitely agree with you. It's important to present, but
Thanks for putting all that together.
Okay, does anybody else have any other comments or questions on that? All righty. Seeing no other comments or questions surrounding that, move on to our next item here. We got about 8 minutes before Dan Kane needs to leave to go do job 1.0. So this looks like a food establishment inspection or new construction or remodel.
yep. So we didn't really have anything in place before, and Michelle had something, but it's smaller. I think it's less educational. I like to present the data, and I like to present an explanation when the new owner is doing it, so they can understand what we're looking at. They can understand that the food code is part of that as well. So it's broken down to what looks like many pages, but it has a lot of explanation along the way as well, and stuff that even if it wasn't in those pages, it'd be something I'd be asking anyway. So at least it's upfront about it. So this is something that we would plug into OpenGov.
What part of what would all of these pages be relevant within OpenGov? Or some of them more like a rubric that might go in a couple of front matter pages that don't need to be scanned in necessarily after they're filled out? Or is it generally just all?
So it won't be scanned. It'll be interactive questions, and then there'll be conditions based on those questions for ifs, ands, or buts, and different directions that those will go into, depending on what type of establishment they want to open. So it will be pretty interactive.
Okay. Is this something that you're looking for the board to have comments on in a little bit? Because this is the first time we're being presented with it, and you said this is going to be something that's going to be online with OpenGov, you said.
Yep. It's just for you to get an idea of what I look at and what I think is appropriate for a new establishment that want to come in town. Just so you have a better idea of what I look at and what I do too.
Okay. Mr. Baker, do you have any comments?
I think it's very thorough. It's great that we'll have something in place. I think it's appropriate to put this up into OpenGov when we're ready and keep on going.
Excellent. Mr. Fratelloni.
Thank you for the meeting. I think that was it. Anybody makes a motion to adjourn?
I don't think I'm quite ready for the motion to adjourn. However, if that's which, are you proposing that motion, Gino?
No, I'm only asking if anybody likes to have the motion to adjourn. But it was very nice, meeting that we had tonight. It's a lot of things that goes on and we can't solve everything in one day.
Okay. I'm not going to take that as a motion quite yet.
No problem.
Okay. Thank you, sir. Mr. Kane, do you have anything on that right before we got about 5 minutes left?
Um, obviously very in depth. I don't think it's unreasonable for a new organization coming into town to at least walk through, think through all these things. To agree, these are all questions that you'd either be asking at the application time or during that first initial walkthrough for an inspection. So having them kind of think about it ahead of time, and lots of great educational pieces that obviously any good restaurateur, serve safe folks should have the answers to, or certainly be aware that they need answers to them. But I think having it spelled out that set of here's what we expect you to have answers to as we going through your initial inspection and approval, it's great. I think it's thorough. I can't say it's complete because I don't know. This is not my expertise, but excuse me, my read through, it looks like you've hit everything I would think of. Again, both asking the questions, but also educational piece, which I am always a fan of when we can. That I'd rather teach them than penalize them for not knowing. So yeah, I think it looks great.
All right. I agree with everything that's been said so far. I think it's amazing. It's definitely a script kind of to walk through and things like that. It's kind of like talking points. Okay. So that's all I have for that. It looks like that's the last thing in the packet. Unless there's something else in there, Francis, you wanted to chat about.
There's a caterer kind of notification thing I was thinking about doing.
I thought that was all part of it, but it's separate. The catering one is separate.
That'd be separate.
Okay.
By code right now, they're required to, caterers are required to notify us when they're coming to town
Yep.
within 72 hours of an event. They don't do that, and we don't have anything spelled out. So it's kind of trying to get people to adhere to a process. So we know what events are going on in town, and we also know what kind of foods are there in case an event does happen where we need to step in. So having a form in place and having them fill out what types of foods, when it's going to be served, what their kind of food safety protocols are in terms of a long service period, just allows us to keep a better look. And they also know that we're also paying attention as well.
That sounds great. Yes, Dan.
Obviously, we're not going to license every caterer who comes in because that's unreasonable necessarily. But assuming that caterers coming in need to be licensed in their town of operation kind of thing. So if you have a Littleton agency who's catering something in Acton, you are licensed and inspected where you're starting, and as long as you notify kind of thing. Is that kind of the approach for caterers? They just need to be licensed and approved in their official business location, and then just notify us that they're going to be functioning under their visiting license at this location. Yep. Okay, that makes sense. Just a double checking.
Okie. And how are we going to get the word out to people that are coming in for a catering event that they need to go and inform us that that's happening? What's going to be the procedure or policy how are we going to let people know about it?
A lot of times it's businesses that are operating in our general area and go to all the same towns. So it's a matter of notifying all our neighbors, this is what we're doing. They might take a similar approach as well. But we've also been able to track down a lot of caterers that have been coming in town, especially to one certain establishment in town. So that word is also beginning to come out too. So usually with mobile food and catering, they get the picture pretty quick.
Got it. All right. And maybe something up on the website or something like that eventually that, hey,
Yep.
caterers. Okay. All righty. All right. Did I miss anything else in the packet that my eyeballs are failing to read because my PDF viewer is not allowing me to zoom in? Technology. I mean, a guy is a computer scientist and he can't even get technology to work tonight. This is nice. All right. Hearing no other administrative matters, we've already done that. Correspondence. The only thing that I had for correspondence was the inspection for our animal stable inspection and things like that. Have we moved any more in a direction in that yet?
No, so I'm gonna bring that to the next meeting. We're
Okay.
gonna have a regulation and kind of a more formal process going into the fall, so that's more coordinated with animal
Okay.
control.
Yeah, I'm starting to notice some things that we may need to start paying attention to, just listening to the news. So bird flus, H5N1 in dairy and things like that. So I know we don't have any issues with that, but if we do have cows in town, we want to know about where they are and things like that. Okay. Any other board member updates? Going once, going twice.
Great.
And I see no attendees right now in our public waiting area, so I'm going to assume that there's nothing else for public input. And so, does anybody else have anything else they want to cover? All right, Gino. Oh, yes, Mr. Baker.
Go ahead for Gino. Go for Gino.
Go for Gino.
Well, when the meeting will be ended, just before I forget, I want you guys to have a very, very Merry Christmas. And I hope you have a good year. Just be careful going outside if it rain and icy and everything. I don't want nobody to get hurt.
Oh, Gino, I really appreciate that. Thank you so much, sir. Do I have a motion?
I don't know. Would you accept mine?
I vote. Yes. Right. This would be a great
Okay.
time for your motion.
Okay. I make a motion to adjourn the meeting tonight.
Do I have a second?
Second.
Dan Kane with a second. I'll do a roll call vote. Mr. Kane,
Dan Kane votes yes.
Mr. Baker,
Kevin Baker votes yes.
Mr. Fratelloni,
Yes.
and the vice chair votes yes. So this concludes our December 11th meeting. Thank you so much, everybody, and have a happy holidays and a safe holidays as well.
Just be safe.
Thank you all.